Assalamualaikum and hi everyone. Today I will be giving a brief overview of Fragile X syndrome. Fragile X syndrome is a genetic disorder caused by an abnormality in the X chromosome. It mainly affects brain development, which can lead to learning difficulties, intellectual disabilities, and behavioral challenges. This condition is also known as Martin-Bell syndrome, and it occurs due to abnormal DNA repeats in a gene called FMR1. Fragile X syndrome is also one of the most common inherited genetic causes of autism. In terms of prevalence, Fragile X syndromes affect about 1 in 7,000 males and around 1 in 11,000 females. Although fewer females are affected, many can be carrier of the condition, and carrier frequency may vary depending on the population and testing method. Now let's talk about the inheritance pattern. Fragile X syndrome follows an X-linked inheritance pattern, meaning it is passed down through families via the X chromosome. Females may not always show obvious symptoms, even if they carry the gene. Also, father pass the gene only to their daughters, while mother have an equal chance of passing it to both sons and daughters. So we now know what Fragile X syndrome is and how it is inherited. But what actually happens at the genetic level that causes these symptoms? To answer that, let's take a closer look at the mechanism of Fragile X syndrome.
For my part, I will explain the genetic mechanism of Fragile X syndrome. Fragile X syndrome is a genetic disorder caused by a mutation in the Fragile X messenger ribonucleoprotein 1 or FMR1 gene. It is located on the long arm of X chromosome. Under normal condition, the FMR1 gene contains around 6 to 55 CGG repeats, and this allows the gene to function normally and produce a protein called Fragile X mental retardation protein, or simply known as FMRP. It plays an important role in regulating protein synthesis in neuron and supporting normal synaptic development in the brain. In some individuals, the number of CGG repeats increase to between 55 to 200 repeats. It is known as pre-mutation. In this stage, the FMR1 gene is not silenced and DNA methylation is usually reduced or absent. As a result, individual with pre-mutation has lower the normal amount of FMRP. However, pre-mutation carriers are at risk of developing conditions such as Fragile X-associated tremor or ataxia syndrome and primary ovarian insufficiency. The pre-mutation can expand into full mutation in the next generation. However, in individuals with Fragile X syndrome, there is an abnormal expansion of CGG3 nucleotide repeats. The number of repeats exceeds 200 and is known as full mutation. Although CGG repeats are still present, the excessive repetition causes the DNA region to become unstable. As a result, the body adds methyl group to the FMR1 gene through a process called DNA methylation. This methylation acts as a silencing mechanism, prevent the gene from being transcribed. In other words, the FMR1 gene is present, but it is turned off. Because the gene is silenced, the body is unable to produce FMRP. Without FMRP, protein production in neuron become uncontrolled and leading to abnormal synapse formation and disrupt neural signaling. The impairment in brain development and function ultimately cause the cognitive, behavior, and neurological features seen in Fragile X syndrome individuals.
Hi everyone. Today I'm going to explain the common symptoms of Fragile X syndrome. The symptoms can be divided into 4 categories. First, development and cognitive symptoms. Second, emotional symptoms. Third, physical features, and lastly, behavioral symptoms. Development and cognitive symptoms included intellectual disability, learning disability, delayed speech, and delayed milestone. This means the person will learn slowly and has poor academic performance, especially in mathematics. Delayed milestone usually occur in children where they speak or walk later than expected. Next, emotional symptoms included anxiety, depression, and obsessive-compulsive behavior. The symptoms will affect the way the individual responds to stress and may disrupt their mood regulation. Next, physical features. Individual with Fragile X syndrome has long and narrow face, large forehead, flat feet, and hyperflexibility joint. Lastly, behavioral symptoms. Behavioral symptoms included ADHD-like symptoms, poor eye contact, sensory issues, and anxiety and shyness. Sensory issues is a condition where a person is very sensitive to strong stimuli such as loud noise or bright light. These symptoms really affect their communication with other people and social interaction. In conclusion, these are the common symptoms of Fragile X syndrome. The symptoms may vary from mild to severe among individuals, but the Fragile X syndrome mostly found and more severe in males. That's all from me.
Hi, I'm Saida Nafisa. I'm going to talk about the diagnosis of Fragile X syndrome. Fragile X syndrome is usually diagnosed through a combination of clinical evaluation, genetic testing, and in some cases prenatal testing. First, healthcare providers start with clinical evaluation. This includes the reviewing of family history, especially if there is a known history of Fragile X syndrome or unexplained intellectual disability in the family. Parents are also asked about the child's development milestones such as delays in speech, learning, or motor skills. A physical examination is then performed to look for features commonly associated with Fragile X syndrome, such as a long narrow face, large ears, flexible joints, and flat feet. Although these features also cannot confirm the diagnosis, they can raise a suspicion. Next, a genetic test is used to confirm the condition. The main test is the FMR1 DNA test, which is done using a blood sample. This test measures a number of CGG repeats in the FMR1 gene. Based on the number of repeats, the individual can be identified as having a normal gene, an intermediate expansion, a pre-mutation, or full mutation, which confirm Fragile X syndrome. This step is the most important for an accurate diagnosis. Lastly, prenatal testing may be offered when there is a known risk, such as if the mother is a carrier of the FMR1 gene mutation. Fetal DNA can be analyzed using two samples, which is chorionic villus sampling, which take a small sample of placenta tissue. Second, amniocentesis, which is collect a sample of amniotic fluid. This test can detect changes in the FMR1 gene before birth. In conclusion, diagnosis Fragile X syndrome involves clinical assessment confirmed by genetic testing, also with prenatal testing available for early detection in high-risk pregnancies. That's all from me. Thank you.
Lastly, for my part, I will explain about the management and intervention for Fragile X syndromes. There are two forms of management and intervention that we can use for Fragile X syndromes, which are pharmacological treatment and non-pharmacological treatment. Pharmacological treatment use medications such as drugs to manage health conditions and influence the body chemistry, while non-pharmacological treatment use non-drug methods such as exercise therapy, diet, and lifestyle changing to improve well-being, manage symptoms, and enhance the body function. For pharmacological treatment, there are a few treatment that we can do for Fragile X syndromes, but one of the primary medication class used and the mostly used is selective serotonin reuptake inhibitors, SSRI. This is because SSRI influence serotonin pathway involved in mood regulation, and they are beneficial in managing some of the emotional challenges associated with Fragile X syndrome. Drugs such as sertraline and fluoxetine are often prescribed to reduce anxiety and improve social behaviors in children and adults with Fragile X syndromes. They can also help mitigate repetitive behavior and enhance the communication skill of the patient with Fragile X syndrome. Other than selective serotonin reuptake inhibitors, another pharmacological treatment used are stimulant medication, which is methylphenidate. Methylphenidate are frequently employed to address hyperactivity and attention deficits. These drugs can improve focus and reduce impulsivity, which making it easier for individuals with Fragile X syndrome to engage in learning and social interaction. But we need to always remember that they must be carefully monitored due to the potential side effects like increased anxiety or appetite suppression. For non-pharmacological treatment, there are a few methods that we can use for Fragile X syndromes, such as occupational therapy. Occupational therapy for Fragile X syndromes will aim to maximize the individual independence in their ability to carry out their daily routine and everyday tasks. Another method that we can use for non-pharmacological treatment for Fragile X syndrome is behavioral intervention. Behavioral intervention is slightly similar with occupational therapy, but behavioral intervention is more focused on their observable behavior. Just now, I already explained about the current method treatment for individuals with Fragile X syndromes. There are also future treatment that already being researched for Fragile X syndrome, which is gene therapy. Gene therapy refers to correction of abnormal gene function using nucleic acid, which is DNA and RNA. But this future treatment has a major obstacle that remains the difficulty of delivering the gene therapy agent across the blood-brain barrier.